This short presentation reviews the Entyvio study, EVOLVE. The indication of Entyvio is shown here. In order to support physician decision-making on the optimal first-line biologic in patients with ulcerative colitis and Crohn's disease, EVOLVE addresses an unmet need for data comparing the clinical effectiveness and safety of Entyvio and anti-TNF-alpha treatment in a real-world setting. These treatments were compared over 24 months post-treatment initiation. EVOLVE was a real-world, multi-center 24-month retrospective chart study that included 1,095 adult biologic-naive patients with ulcerative colitis and Crohn's disease treated with Entyvio or an anti-TNF-alpha therapy between May 20, 2014 and July 31, 2017, who had a greater than or equal to 6 months of follow-up data. The study was conducted in Canada, Greece, and the United States across a total of 37 sites. The primary outcomes were clinical response, clinical remission, mucosal healing, and adverse events. Secondary outcomes included treatment persistence, dose escalation, disease exacerbations, and disease-related surgeries. Similar rates of clinical response were observed with Entyvio and anti-TNF-alpha treatments at 24 months in adjusted cumulative analyses. Rates of clinical remission were also shown to be similar between Entyvio and anti-TNF-alpha treatment over a period of 24 months. There was also no statistically significant difference in mucosal healing rates between Entyvio and anti-TNF-alpha treatment over 24 months. Importantly, patients in the combined ulcerative colitis and Crohn's disease populations who were treated with Entyvio had significantly lower rates of serious adverse events and serious infections than those treated with anti-TNF-alpha at 24 months. In patients with ulcerative colitis, rates of treatment persistence were significantly higher, dose escalation rates were significantly lower, rates of disease exacerbations were lower with Entyvio versus anti-TNF-alpha treatment, and disease-related surgeries were similar. In patients with Crohn's disease, all outcomes were similar between the treatment cohorts. To summarize, 1,095 biologic-naive patients with ulcerative colitis and Crohn's disease were enrolled from 37 centers in Canada, the United States, and Greece. Similar rates of clinical response, clinical remission, and mucosal healing were seen with Entyvio versus anti-TNF-alpha. Incidence rates of serious adverse events and serious infections were significantly lower with Entyvio versus anti-TNF-alpha in the combined ulcerative colitis and Crohn's disease populations. Treatment persistence rates were significantly higher with Entyvio versus anti-TNF-alpha in patients with ulcerative colitis. In patients with Crohn's disease, treatment persistence rates were similar between Entyvio and anti-TNF-alpha. Dose escalation, disease exacerbations, and disease-related surgeries either improved with Entyvio or were comparable to anti-TNF-alpha. In conclusion, in this real-world study of biologic-naive patients with ulcerative colitis and Crohn's disease, Entyvio and anti-TNF-alpha were equally effective at controlling disease symptoms. But Entyvio treatment had a more favorable safety profile.